Hello everyone, it's Dr. Gupta at the Dermatology Leisure and Vein Center, and we're going to talk about CoolSculpting. So CoolSculpting has gone through quite an evolution, and when it first came out back in around 2011, I wasn't quite sold on the technology yet, so we didn't acquire CoolSculpting as a practice at that time, because the applicator was just so deep and it suctioned so much of the skin and fat that people were actually getting sort of that butter stick looking deformity of the skin afterwards, and then you could potentially get ridges where it would just take off too much fat around the edges and leave you with indentions and dimples. So I wasn't too excited about the technology then, was also worried about possibly actually causing more harm than good, which is something we absolutely stay away from at the practice. So when CoolSculpting evolved and improved their method of actually suctioning the skin, that's when we got into it. And now we're into the third generation, which is CoolSculpting Elite. So this has the most surface area coverage, and it also has a much gentler way of treating the entire area, so you don't get as much skin suctioned into the cup. But the most important part of CoolSculpting really is how it is administered, in the sense that where are we actually placing the applicators, because it's truly a sculpting procedure. So this isn't one of those procedures where you just want to shop by, hey, you know, what does it cost per cycle or whatever, because it's really much more than that. It is the artistic placement of the applicators. Prices are going to be pretty similar across the board, a little up, a little down, but you know, the more important thing is what kind of result are you going to gain, and what kind of experience does the provider actually have in giving you the outcome that you're looking for, and then also being able to offer concomitant treatments or maybe alternative treatments that you might be better suited to. You know, because not everybody who comes in is the ideal CoolSculpting candidate. You may do better with one of our other fat destroying technologies. And we do have several technologies that permanently help to kill fat cells, some with cold technology such as CoolSculpting, but then we also have lasers that will actually use heat and traumatize the fat cells that way, but then you also get really nice skin tightening. Then we have other technologies that work a little bit differently, more physiologically, burning off the fat and permanently killing it, but then also repairing muscle and giving you better tone. And sometimes we combine these procedures together to get really phenomenal results. So it's really about looking at the patient, figuring out what's going to be the best way to get you from point A to point B, and minimizing any potential risks. One of the risks you'll hear a lot about on CoolSculpting is paradoxical adipose hyperplasia, also known as PAH. And that's where your body, instead of killing the fat, may actually make more fat cells in response to the cold technology. And I have actually never seen this in my practice. CoolSculpting has been out for about 10 years. I would say we got into the CoolSculpting space about 6 to 7 years ago, when the technology actually improved and I was satisfied and happy with it. The technology does work really well. I mean, we've never seen it actually fail, but some patients are perhaps going to require a few more treatments than others. But this PAH, the paradoxical adipose hyperplasia, it can happen. And if it does, then the solution is liposuction, which of course you're trying to avoid in the first place, but that does work to help get rid of the fat cells, and the company will actually stand behind the product and help with that. So it's not something to be really feared, but one just needs to be aware about it. And if someone is really worried about that possibility, then like I said, we have so many other procedures, and our practice, we do everything from tummy tucks with liposuction, surgical procedures, to minimally invasive procedures such as liposuction, body tight, and then all the non-invasive and minimally invasive approaches. So that's a bit about CoolSculpting in a nutshell. Give us a call. We'd love to see you and help you on your journey to a better you. Thank you so much for watching.